Hi, my name is Dr. Jacobs. I'm a doctor of physical therapy, advanced clinical nutritionist, and inventor of ASTR. After my second cancer treatment, I used to suffer from chronic pain, migraine, headache, fatigue before I invented ASTR's specialty. If you are Take charge of your health today by signing up for one of ASTR's free online treatment programs. Just click the link on the screen. To become a patient or to purchase ASTR tools, click the link on the screen. If you would like to become a certified ASTR provider, click the link on the screen. All right, Tina, tell me what's going on with your ankles. What happened?
I was trying to get back in shape and started walking, and it first started feeling like I had sprained my left ankle. That's where it first started.
Okay.
And it just kept getting worse and worse. And so I thought I needed new shoes. So I got new shoes. That didn't help. I tried stretches. I tried, compression socks, just different things that just didn't help. And when I went to the doctor, the urgent care, or when I went to my regular primary care physician, they just wanted to give me, medicine, just painkillers basically, which wasn't, it masks the problem. It doesn't help the problem.
Treat the
And then,
root cause of the problem.
Yeah, I tried stretches, which helped, but I think I overstretched because
So
now I have
you're
really
injured
bad.
from the stretching. It's very common actually to injure yourself from the stretching because think about it, if your muscle acts like a rubber band when it contracts, stretch. If you overstretch, you're gonna snap. It's gonna cause more inflammation. So you want to be careful with stretching.
Okay. And I wore a boot for a little bit of time, and when I wore that boot, that's when my right side started getting inflamed and started having problems with that. And I tried cryotherapy for chiropractor. He was doing trying to do treatments on me, and that didn't help. I had problems standing. The sharp pains that go straight up in the mornings.
So your pain more in the morning and subside a little bit with walking, and you start to feel pain with long sitting and stuff walking. So that's a plantar fasciitis.
It gets to the point at work where in the afternoons I have to take my shoes off because of how bad.
So do you feel like sharp stabbing pain, like needles, kind of like when you start to walk, and you feel it in the heel or the plantar part or both?
On the arches part.
The arches, okay. So how long has this been going on?
Since September.
So like about 3 months now.
Yeah.
Okay. So what can we do to aggravate your symptoms now?
Stretching.
Let's do it. Okay. When you do stretching.
It's like a 7.
Okay.
Right here.
Where do you feel it?
Right here. And you can see the nodules have now gotten bigger.
Walking is fine, or just a stretching?
It's more of the just standing still in one place that aggravates it.
How much from 0 to 10?
It's you're saying to
10 is emergency room, 0 is nothing. Standing and
like 7.
7. Okay. Let me see how you walk. So more stretching and standing than walking. But you're kind of limping. Is that your normal speed?
My normal, no.
Normal walking speed?
I'm a lot slower than what I usually do.
Yeah, okay. All right, so we're going to use that for testing. Are you comfortable like that?
It kind
of... Bend your knees, both of them. What about now?
Better.
You comfortable? So your pain is in here?
Yeah.
Outside or inside or both?
Both.
Okay. Which one is worse, left or right?
Left.
Okay. And is that painful what I'm doing, or it's okay?
Only when you pushed on the arch, the nodule.
And here. Yeah. You feel this?
Yeah.
Make sure it's not painful. How's that?
Okay.
Okay, I will assume no pain as long as you're not saying anything, okay?
Okay.
Is it too much?
No.
A little bit?
Yeah,
Make sure
you
you tell
moved
me.
it down.
Make sure you tell me, okay? Is that too much?
Yes.
Sorry. Okay, don't kick me, okay?
I know.
Make sure you say it nicely. So your pain coming up here or it's just localized there?
It goes on the inner.
You're very tight here, you feel
Yeah.
that?
Oh yeah.
Is that too much?
Stretching is definitely.
Okay. Make sure you tell me if it's too much, okay?
Okay.
How's that?
Okay.
Okay. If you feel pressure, that's normal.
Okay.
If you feel pain, that's
Okay.
we don't want to do
Then
that.
that was painful.
Yeah, because I don't want to cause more inflammation, okay? If you have inflammation.
Okay.
How's that?
That's okay.
There you go. Okay, it's gonna feel cold, okay?
Okay.
I will let you feel the scar tissue now. You feel this grinding here?
Yeah.
That's a scar tissue.
Wow.
You have a lot of scar tissue
Oh,
here,
yeah.
right in the spot you're complaining of.
Yeah.
So that's usually feel like you're standing on a rock.
Yeah.
Can you imagine you're standing on a rock?
Yeah.
And I can feel this is like,
That
oh,
hurts.
sorry.
That
Okay.
shot through me.
Sorry. But you feel that grinding here?
Yeah.
Okay, that's good. Sorry. Is that too much?
Yeah.
Really?
Yeah.
Okay, let me show you how much pressure I'm applying. You feel this too much?
No, that feels fine. But when
That's the exact pressure.
oh, really? I think because they're inflamed.
It's inflamed. That's why,
You gotta do it.
no, we don't want to do it to inflame it more. So make sure you tell me.
Okay.
But you can feel all those bumpy areas, scar tissue here.
Yeah.
Is that too much here?
Just not as hard.
Yeah, and that's the exact same light pressure I did it to another area.
Oh wow.
That's a sign of inflammation.
Yeah.
So, any seizures or pacemaker or anything like that?
No.
Okay. So I'm gonna work on the proliferation stage now. Work on the scar tissue, fascial restriction, muscle spasm, and trigger points, and see how you feel. I'm not gonna jump to the inflammation protocol. I'm not gonna use the Magna Heal now until you figure out if it's purely proliferation or you have some inflammation. I know from you not tolerating
Yeah,
to,
not that.
you're really inflamed here.
Yeah.
What about here?
Not as bad.
Huh?
Wow, you can really feel that.
You can
Crazy.
feel all those bumps, yeah?
Yeah.
If you don't have a scar tissue, it should feel like nice and smooth, like here, feel that?
Wow.
And
Yeah.
this, like knotted. So you can stretch it forever. You're not gonna untie this knot,
Wow.
you know, but the problem is overstretching,
Hurt it more.
you're gonna cause micro tear, which will cause inflammation and cause more scar tissue. It's kind of like make it worse.
So I shouldn't be rolling my feet in the morning?
I will give you more effective stuff than rolling, okay?
Okay.
But don't do stretching. I don't
Okay.
give patients stretching. We're gonna do other stuff that's more effective. We need to get your inflammation down.
Yeah.
So a couple of things.
Okay.
Well, I will have you stand up and try to stretch and tell me how you feel before I do any more work for inflammation.
Okay.
Do you have constant pain sitting?
I get to the point when I'm sitting, I can't. I have to take my shoes off in the afternoon because it's just so badly inflamed.
Let's try to stretch it now and tell me how that feels.
I could feel a difference in my legs.
What do you feel?
I feel a it's like I could feel my legs. Does that even make sense?
You have more sensation now
Yeah.
because when you had a scar tissue that compress on your nerve ending, that decrease your sensation, decrease your feeling. So let's go down and stretch it and tell me how that feel.
Oh, I could do it without.
You're
any
going
pain.
further, actually.
Yeah.
How's that?
Oh my gosh.
Any pain or it's totally
No.
gone?
It doesn't feel painful like that.
Okay.
I could even stand without it feeling like something's going to shoot up my leg.
Okay. So let's try walking now.
Feels a lot better. Oh my gosh.
Am I walking different?
You're not limping as before.
Yeah.
Suck your stomach and land on your heel. How's that feel? Any pain or it's gone?
No, it's gone.
Uh-huh.
It feels a lot better. My legs just feel different. It's,
What's different?
it's like I've got my feeling back.
Sensation.
My legs. Yeah.
That's good. Yeah.
Oh my god.
Let's do one more stretch for me. So you did before we start one stretch and you start to feel the pain. You said it was 7 out of 10?
Yeah.
How
it
about
was
now?
I don't feel it.
Let's do 5.
5 stretches?
Yeah, back and forth.
I can't believe I could even stand. It feels like I could stand correctly flat before I felt like I was just
not able to put weight on it.
Yeah.
Okay. You're really going further, actually.
I know.
Yeah.
That's amazing.
It's nice. Okay.
Oh my gosh.
Are you counting? If you're not counting, we're going to do 500, okay?
This is 4.
Okay. I'll take your word.
Oh my gosh. Now that last one, I felt it actually here.
What did you feel?
Just the sharp right here, but it just stayed right here.
Is it gone or you still feel it?
Yeah, no, because I stopped stretching.
Okay, let's drink a little bit more water and we'll do stretching again.
I said, I can't believe I've been just standing this long, even drinking the water, and I don't feel like I need to adjust my weight or something because I can stand.
So let's try to do 5 more and stop when you feel that any pain.
Ooh. I don't know why I did that. I've never had that before.
Okay.
Am I stretching like, oh?
I will not hold it, just going back and forth. Because the stretching could cause inflammation. It's just testing now.
So don't go as far down.
Yeah, just be comfortable. Don't overstretch. Remember, stretching causes inflammation. We're just doing the range of motion that you had trouble with.
Okay. This is the 5th one.
Okay, so how do you feel now?
Feels a lot better than it has in a long time.
Uh-huh. And you tried chiropractor, cryotherapy, boots, pain medication.
Compression socks.
Yeah.
Yeah.
Mm-hmm.
Big difference.
Yeah.
I can stand. I can function.
Yeah.
I feel my legs. I didn't realize that I couldn't.
Yeah. Awesome. Thank you. Okay, Tina, so we used the Magna Heel after the treatment because visually when you were sitting, you start to notice your feet swelled up.
Yes.
So can you give me a feedback after, like, while you're sitting, you put the Magna Heel for a few minutes.
Yes.
What's going on?
It dramatically decreased, and the pain from it inflaming so badly has gone down. My feet feel so much better than what they were when I was sitting.
Did you visually see difference in the swelling?
Itself is probably easily half.
In just a few minutes
Just
with
a
the
few
Magna
minutes
Heel.
on there. Yeah.
Awesome.
I did notice you need to drink a lot of water with that.
Okay. Awesome. Yeah. Thank you. Thank you.
Okay.